when someone's using marijuana, THC and CBD is kind of the combination for this. When you think about PTSD, it helps them relearn those traumatic memories in a place where they feel calmer. So it allows them to re-experience, go work through those events, those traumas, those things they've been through. And it allows them to change the way that their mind is processing those traumas, the way that they feel their bodies respond to those traumas. It keeps them calmer when they're envisioning those traumas so they don't have quite that heightened experience. A lot of people talk about using marijuana for anxiety. With that, it does create this cycle where you calm down because you're using cannabis, but you're not actively learning those skills to manage anxiety. So when we talk with people who are actively using cannabis and don't have the intention to stop, one of the things that we really highlight is if you're going to use it for anxiety, you still need to make sure you're learning those skills to manage your emotions. Because if not, you're going to just get in this feedback cycle where you calm down, but the only way that you can calm down and manage your anxiety is with cannabis. So we often talk to people about, well, if that's what you decide is helpful, that's their decision. But it's really important to continue to work on those skills to manage it as well. And sometimes people find that if they're in a calmer state because of cannabis, it's easier to learn those skills if they have the support to do so.
In 24 states in this country, marijuana is legal recreationally. I believe in Ohio, you're one of those 24 states, if I have that correct. 38 states and Washington, D.C. have it legalized medically. So I mentioned this earlier. At this point, basically, there are fewer states where it's not legal than states where it is legal, at least in some capacity. It's obviously not legal at the federal level. And up until basically COVID forced the NBA's hand to an extent, it was not legal in any capacity in any professional or even amateur sport. And it still isn't in many of them. Why do you think it's taken so long, I guess you could say, for sports in general to kind of get on board with the state? Because if you think about it, you're in the state of Ohio. So you take a player at Ohio State University. For any other student on the campus, it would be legal for them to go get it and to smoke it, and it's perfectly recreation legal. If one of the players on the football team did it, and they popped a positive on a drug test this weekend, they're not playing, or I guess it wouldn't be this weekend, but they wouldn't have played last week. They wouldn't be playing in their next game. Why have these sports leagues been so, in your opinion, apprehensive to kind of get on board and to allow it in the same way that so many of these other states are now saying, yeah, okay, if you want to do it, you're an adult, do it.
First of all, thank you for the heartbreaking reminder that we will not be playing this weekend. Thank you so much. So, I think one of the things we need to look at is like the historical perspective. So when a substance gets banned, it has to meet 2 of 3 criteria from the anti-doping agency. So it has to be the potential to enhance performance, it has to present some sort of health risk to the athlete, or it has to violate the spirit of the sport. So think about this in the context of, like in football, when there's a play on the field and then they review it. If the play can't be totally seen as indisputable evidence, it's going to stand as called, right? So when the decision was made in 2004 to put cannabis on the banned substance list, they were doing the best they had with the information they had in 2004. So that was the play that was called on the field. Cannabis is out. You can't have that. I mean, when we think about it, so there are studies that show a potential health risk for cannabis, but it's in patients with significant coronary artery disease. But it did show decreased time to exhaustion, concern for increased heart risk, the potential to enhance performance. It's anti-inflammatory. Is it going to help with muscle repair? Is it going to help in recovery? Is it going to make it so that they can perform better under stress because they're not as anxious? Does it violate the spirit of the sport? Well, considering its legal status, they don't want athletes doing things that are illegal. That's not going to look good for the league. That's not going to be perceived as these people who were watching setting a good example. So it goes into that ethical part. So I think in 2004, when the decision was made to put it on the list, they looked at the evidence that they had at those times, the studies that they had at those times, and they made a decision. And so I think since that time, in the 19 years since then, we've been looking for the video evidence to be able to overturn the play. And we just haven't had that. We don't have that firm evidence to say it's, overturned. So I think right now we can't say it's a confirmed call, but I think we have to say it stands as called at this point.
I love it. I love that analogy, and that does make sense. It's a fantastic analogy.